So, good morning or good afternoon. Actually, I'm in Liberia, where it's 1:30. So, thank you so much for having me. I'm Kokou Alinon. I'm the Regional Director for Africa CDC for Western Africa. Just a quick overview about our collaboration with EU and also some of our achievements. Yeah, so Africa CDC, as you know, is the health agency of the African Union. We have a vision to safeguard Africa, and our mission is on the continent. We have an aspiration to become a worldwide organization. So this is our strategic plan from 23-27, focus on 6 areas: disease control and prevention, surveillance, API, emergency preparedness and response, and also lab system and product manufacturing. So after the COVID-19, the lesson learning from the COVID-19, we came up with a new public health order focused on 5 areas. So this new public health order allowed us to focus our energy on strengthening public health institutes and strengthening public health workforce, and also increase domestic health financing, and a partnership, an action-oriented partnership, and a big effort is ongoing on expand local manufacturing. So Africa CDC, the HQ is in Addis Ababa, Ethiopia, but we do have 5 regional offices. One of the regional office, the biggest, is Western RCC, where I'm leading as the regional director. So we do have 15 member states, but other RCC, we have the Southern RCC, which is based in Lusaka, and we have Eastern RCC based in Nairobi. We have the Central RCC based in Libreville, Gabon. And for the Northern RCC, it's supposed to be based in Cairo, but the works agreement is still ongoing. So this is my office in Abuja. The Western RCC is based in Abuja. So this is just my office. So we have the 5 regional directors under the Director General, who is based in Addis Ababa. So what are we doing at the RCC level? The RCC level, the idea is to try to operationalize the RCC. So who will be focused on policy development, and the implementation of all the activity will move to the RCC, and RCC will be working directly with the member state, with the National Public Health Institute, but also regional economic community to touch base the really need of countries. So for the RCC, we are touching base on laboratory system, disease control and prevention, surveillance, emergency preparedness and response, National Public Health Institute, but we also have other initiatives like RISNET, IPC, Health Economic Climate Change, Regional Knowledge Hub, Health Information Exchange, and also a vaccine manufacturing. So those are our portfolio as regional office. So the strategic partnership with EU, I want to highlight some of the initiatives we are having with Team Europe. So with Team Europe, this is about 5 years we are working with Team Europe, and we are getting direct support from CDC, European CDC, and other organizations. So for Team Europe initiative, we have a collective effort in some of our member states. And the focus area are the local vaccine. So actually, we know that Africa, we are um, relying on vaccine coming from Europe and other parts of the continent. We are just producing about even less than 1% of our need. So there is a big effort that is ongoing to push for that area. Certain health and security and public health institute is ongoing. We are getting a great support from Robert Koch Institute. They are really supporting us in countries like Namibia, like Madagascar, where they are pushing with us to establish National Public Health Institute. Health digitalization is ongoing with Team Europe initiative. This is a bit, yeah. Sorry. So with ECDC, European CDC, we also have a partnership since 2021 to harmonize data sharing agreement. We use to have exchange of staff like the way we used to do with RKI. Myself, I've been in RKI 2 times for 2-3 weeks where we develop a joint projects that are ongoing. So this exchange focus on capacity building, but also lesson learning from each other to promote best practice. So on the lesson learning from this partnership, so I want to highlight on the importance of Africa leadership. We really need to centralize this partnership so we take advantage of all this great job that we are doing. So this is some of the way we really want to go in terms of communication, coordination, infrastructure, and also in terms of best practice, leadership, bureaucracy, and others. So our vision with EU moving forward, we really want to co-create with AU, we want to discuss and we come up with something that is aligned to our programs. So some of the pillars that we are really looking forward to co-create is in terms of strategic planning. We really need to come up with a joint action plan which will be linking to our AU Agenda 2063, where we really need to establish a clear and accountability framework so we maximize all the support we are getting in terms of finance. We really also need to invest in a local ecosystem beyond facility. We need to invest in local R&D and also regulatory strengthening. Health financing is something that we're pushing actually based on what is going on with the new administration from US. We really need to develop a new approach for health financing. Knowledge management, data sharing, we really need, we know diseases doesn't have border, disease doesn't require visa to come to Africa or to go to Europe. So we need to share data and then we go together in terms of governance. So I want also to let you know that we are working with other partners. It's good to know so we don't duplicate to avoid duplication. So most of the partner are China, and also actually we are having some MOU with South America. We signed an MOU with Brazil to help us also to strengthen National Public Health Institute. We know RKI is already pushing with this, but we know more on because the plan is to have the 55 member states of Africa Union establish a strong National Public Health Institute. So in terms of our collaboration with other continents, I already mentioned that we have World Bank, we have GIZ. GIZ is also with the German government. We also have a Quaker, RKI and WHO. RKI is one of our privileged partner. We are doing. So I was here. I was mentioning about some of the collaboration we have with GIZ, with Quaker, and I want to use the opportunity to appreciate the great support and collaboration we are having with RKI, specifically working with Dr. Chabel. They are really supporting this NPHI implementation, and so some of the evaluation of our program. We really need to know where we are and where we are moving to. So their work is really supporting us to know how we are performing. Next slide. Yeah, so I was mentioning about where we really need to go. This is a kind of brainstorming. Team Europe and Africa CDC. Actually, with our mandate, we are leading the health sector in Africa. We have a joint action plan with WHO. Actually, for the Mpox response, we have a continental joint team where we have WHO, UNICEF, and the other partners. So we really need to establish this very great partnership, focus on transparency, accountability, and also co-create, like you already mentioned on one of my slides. We really need to sit together to see what are the areas we can put our effort together to avoid duplication. Next slide. So some of our the recommendation, we really want EU to strengthen regional organization. Like I mentioned, for example, actually Africa CDC, the plan is to strengthen regional community and also our regional offices. So the HQ will be a kind of doing with policy and the others. So we really request EU to work directly with RCCs, Regional Coordinating Office, who are already working directly with member states. In terms of representation, we want EU to consider Africa CDC. So when it's come to these guys to be on the table, we need to be there. So we push for the pandemic accord. Africa CDC was there, but we really need to go together. If we can sometimes come with agreements, have the same voice, this will help us. In terms of local manufacturing, actually in terms of vaccine and other product supplies, we are having issue. And COVID-19 showed this. So we really want EU to support us for this agenda to promote local manufacturing. In terms of financing, I mentioned this, all of us, we were affecting in somehow with what is going on with the new administration, US administration. So how do we organize ourselves to leverage on domestic financing? We need technology, we need ideas. So this is an opportunity to go together. And also, for example, Africa Union, they came up with a communique where all the member states signed an agreement that all member states should allocate 15% of their total budget to the health sector. But when you take a country, if even they allocate the 15%, how much is going to the health sector, specifically addressing health issues? We need expertise on this. So those are things that we may need to work together in terms of data sharing, data governance, like the way RKI is implementing some of the research focus on evaluation, vaccine effectiveness. This will help us to move together and address the health security agenda. Actually, One Health is an approach that we really need to consider in every activities that we are planning. Next slide. Thank you so much for having me, and also allow me to appreciate this initiative. We are really available to work closely with you. I've attended your first meeting in Berlin 2 years ago, and I look forward to join action to our speech in the near future.